Welcome everyone to the webinar. We'll give everyone just a quick minute to jump on before we get started. It looks like people are jumping on. I know we only have an hour together, so we'll get started. This will be recorded to listen afterwards in case you missed the beginning part. But again, welcome to the webinar, Safety Considerations as the Re-Entry Process Begins for People with Down Syndrome into Their Communities. Our panelists today are Dr. Brian Skotko, Dr. Nikki Baumer, and Dr. Helen Lyon. We'll answer any additional questions you have that you want to type into the question panel at the end of the webinar as time permits. And without further ado, we will get started. Our first question is, when is it safe for my loved one to return into the community?
I know I've been answering this question for a lot of people in our Down syndrome program at UMass, and I think it's very dependent on your individual situation and the age of your loved one. But I think that now is one of the safer times compared to the last few months, because Massachusetts, at least, and the surrounding states have a lower infection rate right now. And I think that as long as you and your loved one can follow the recommendations about wearing a mask or being with people who are wearing masks, if your loved one can't tolerate a mask, then getting into the community in safe situations with a limited number of people, I would say the time is probably now.
I think this is it's a hard question. It's a question we've been getting for months now, and then there's no real easy answer to it. I think, just as we just talked about, it really is very specific on individual circumstances. If it's helpful, I like to think about sort of 3 different categories of factors to consider when thinking about return to the community and return to activities. And, of course, the person's individual specific health risk factors, their age, those circumstances, whether they're able to wear masks, whether they're able to maintain physical distancing. So all of those factors. Then, as we just talked about, the public health factors, sort of the infection rates in the community, where things stand. And yes, we are in a good place right now, particularly compared to a lot of other states in this country. But things like, what are the number of new infection rates increasing? Are they decreasing? Is there good testing capabilities? What's the monitoring situation? So all of those factors. And then, which I think is some of the hardest part, those are the questions about what specific activity is in question, because as we know, different activities and different things within the community carry a different level of risk. And I think we're probably at a time now where many of us are going to have to start accepting some level of risk, but the level of risk differs for different activities. So certainly there's activities that may be considered higher risk, like being in a crowded indoor space with poor ventilation is going to be a much higher risk than being in an outside space where people are wearing masks, maintaining physical distance, where, there's less likelihood of transmission. So I think that we have to think about those different categories of risk within an activity, but also probably the level of benefit that activity may have. And I think, which I'm sure we'll talk about later, a big priority as far as what has a really great benefit would be schools opening. So thinking about how we can prioritize that and make that as safe as possible is going to be really important, because the level of benefit for returning to school is going to be so high compared to some other activities.
This is Brian Scacco. My video is not working, but I'll say that I definitely agree with my colleagues, Dr. Baumer and Dr. Lyon. Certainly, one size does not fit all, right? We know that members of our community are so diverse and the situations are so diverse. And I know that so many of you are tuning in right now from all states and many countries as well. So where it's going to be really tough for us to give a recommendation that applies to everyone. The way I've been thinking about it when people approach me in our clinic is, one, is it safe for the neurotypical counterparts in your area to go back? So that's first and foremost, and consulting your Department of Public Health in your state or your country to figure out, is it safe for anyone to return is the absolute beginning. And then the next item we think about is if it's safe for the neurotypical counterparts to return, is there anything in addition that that person with Down syndrome has, any co-occurring conditions that place them at higher risk where we need to be cautious? We're increasingly learning that Down syndrome in and of itself is not necessarily conferring increased added risk. There's data coming in from the infection rates that those who have Down syndrome under the age of 40 do not seem to have a lot of the serious co-occurring conditions. But if you're over the age of 40, or no matter what age you are and you have Down syndrome, if you have chronic heart disease, chronic lung disease, diabetes, or some other co-occurring conditions, we might need to take extra precautions. And I would say reach out to your specialist, reach out to your primary care doctor to see whether or not your loved one with Down syndrome needs to have some extra precautions to know whether or not they could return at the same time or a little bit lagging after their neurotypical counterparts. And then I completely agree with Dr. Baumer. It's a matter of, if they are safe to go back, how do we keep them as safe as possible in the environment that they're going back? And sometimes that means wearing masks. Are they able to tolerate masks? Sometimes it means social distancing. And we know that many people with Down syndrome, even if they can, might not be willing to partake of all those precautions, and we need to take that into account.
Thank you all. Our next question is, what should I consider before my loved one with Down syndrome returns to daycare?
That's another question that absolutely depends on the style of daycare. But if we assume we're talking about some of the younger kids and group daycares, the considerations, I think, should be the teacher to student ratio, and also their facilities for hand washing, because besides masks, the most important thing you can encourage your loved one to do is to wash their hands frequently. And I think making use of some of those teaching videos that show them how to wash their hands, and not just to do it for 20 seconds, but to really get, you know, all the surfaces and between the fingers and all of that. Making sure the facility has adequate hand washing, adequate sort of spare masks, and teachers who know your child really well and know the other children really well, so that they can anticipate some of the issues that can happen between kids. And then hopefully keeping the size of the group your child will be with small, so that it's the same cohort all the time. So that there's a sort of just a pod of kids who are only exposed to each other and their families and don't have a lot of other exposures. So that's the recommendations I've been giving people. And I would also add to this that obviously the second that your loved one seems ill, they cannot go. And I know I've struggled in practice with daycares having regulations about what temperature you can have and still go to daycare versus when you take your ibuprofen and if you have a temperature and go to daycare. But now I think if there's any symptoms of a fever, cough, runny nose, you know, anything that could indicate COVID or some other infection that could mimic COVID, it's important that you trust those kids will be screened out by their parents, or upon approach to the daycare, that if they have noticeable symptoms, that, you know, they'll be encouraged to go back home. So I'll remind people that if you have backup plans to your daycare, If you have a first call person who isn't you, a grandparent or something, you have to keep in mind that people of the older generations are more at risk to COVID-19, more at risk for having bad outcomes from it. So your backup plan may need to include either a grandparent who's really good with a mask, if your child's good with a mask, or other people who are maybe not so high risk. And having 2 backup plans to daycare would be good, because at some point your child will have to stay home, and at other points, if children get infected, they may close much more easily than they would at other times. So I think considering your own state, like Dr. Skocko mentioned, and considering the actual daycare and asking them to show you what precautions they've taken would be helpful.
This is Dr. Skocko. I would agree with all of that, and just add that if your child has still unrepaired heart issues, just make sure you check in with their cardiologist just to make sure it's safe for them to return. But again, the good news from the data is that those individuals with Down syndrome, particularly those under the age of 20 with Down syndrome, if they do get COVID, it doesn't look like they suffer from the serious consequences. But again, the exceptions would be perhaps those in this age group that would have unrepaired heart issues.
Or severe asthma as well, right?
Yeah, I would agree with that.
Our next question, are people with Down syndrome at a higher risk for contracting COVID-19 than the general population if they are otherwise healthy and have no health issues? Are they at any higher risk of having a severe case of COVID if they do contract it?
So the first half of that question, I think, is still a little bit difficult to answer. Are people with Down syndrome at higher risk for contracting COVID-19? We really do not have a lot of data at this point to be able to really guide the answer to that question. I think that especially potentially for children and individuals with Down syndrome, we have done a really good job at trying to encourage physical distancing and minimizing the risk of exposure. So we don't really know how many people with Down syndrome have been exposed to COVID-19. So we truly can't answer the first part of that question without that information. But I think that we have a little bit more to say about the second half of the question, which is, are they at higher risk of getting severe illness from COVID-19 if they do contract it? And I think that what we are seeing is that right now, for individuals who have Down syndrome but no other medical conditions, if they are younger, especially children, it does not seem like having Down syndrome in and of itself would increase their risk of severe illness. The people that seem to be at highest risk are the same people who are at highest risk in the general population, which is especially older individuals, people who are living in group settings, congregated living environments, or people who have other medical conditions that may put them at higher risk. The one thing that I will mention, though, it's still very preliminary, but from what we've learned so far, it seems like the risk of severe illness or death, while older individuals in the general population seems to be reported to be around 65 or above. That's the number that the CDC has been given us. In people with Down syndrome, that's probably younger. So it may be people who are 40 and up that have a higher risk of more severe illness or death from COVID-19. So I think that that's important to consider. But I think that, we're going to learn a lot more as more data is collected, and we'll hopefully be able to answer that question with more evidence to back it as we get more information.
And that data is starting to be collected. Dr. Baumer, I know you've played an instrumental role in some of the survey for the T21 Research Society. Would you like to make a pitch for that, and perhaps afterwards MDSE could list a link to that just so families know where they could get the up-to-date data?
Sure. So the T21 Research Society has put together a task force that has individuals from all over, internationally, lots of representation from the United States as well. And we are doing surveys of people who have had symptoms or who have tested positive for COVID-19 that clinicians who take care of them or caregivers or the individual can complete in order to share their experience of the individual with COVID-19, asking about symptoms, what the severity of illness was like, what the treatments were. And the more that we gather this kind of information from all over, the more that we're going to understand exactly what COVID-19 looks like for people with Down syndrome. So yes, it would be great for anybody who does know somebody who has had COVID-19 to encourage their healthcare providers to fill out the survey themselves, and that will just really add to the knowledge that we're acquiring.
Great, we will definitely include that in our resources that we send out following the webinar. Our next question, when can my loved one visit grandparents or other close family members?
I would argue there's two important things for us to keep in mind. One, the elderly, as we already talked about, are among the most vulnerable to have serious complications from COVID-19. And then the second element is that young persons with or without Down syndrome are among the most likely to be asymptomatic carriers. And so you could almost remove Down syndrome from this question and just think that the rules that apply to the neurotypical population apply here. And every situation is unique, and every situation needs to be taken into account. But there are some resources to kind of discuss as a family, and I think it's important to have that conversation as a family with grandparents, where people are traveling, what precautions are being taken within a family unit so that everyone could stay safe and healthy.
And it depends on, how you have to travel and what state you're going to as well. I can see signs up on the roads where different states are recommending that if you cross into their border, you should quarantine for 14 days. So if it's a situation where you would usually visit the grandparents and they're not in a whole different exposure region from you, I completely agree with what was just said. And I think that picking an outdoor venue where there's plenty of airflow, choosing a place where there aren't a lot of other people who've touched a lot of surfaces, or just making sure you have hand sanitizer along, and also encouraging your loved one to maybe not climb all over their grandparent and touch their face and things, but to have some fun activity to do where you don't have to be very close. And I've seen a lot of discussion, and maybe Dr. Baumer wants to comment on this too, about huggers. And a lot of my patients are very affectionate physically. And so taking the opportunity now to talk about what's appropriate and not appropriate, and even, as goofy as it sounds, role play some stuff at home or show them some videos about, where is appropriate, how close you can get, are we going to air hug, and setting up some sort of rules and guidelines with your loved one and the relatives you're going to visit, I think really helps.
Absolutely. I don't really have very much to add. I guess I would just say that all of these decisions are considerations where you have to think about what the pros and the cons are, the risks and the benefits. And I think that there are safer ways to do things, just as Dr. Lyon mentioned. But I would say that visiting loved ones, for my family, I think for a lot of families, the benefit of that is so high on the spectrum that coming up with ways to make that possible and to do that safely may be very, very important for some people. And the decision is individual for everyone, but certainly as much preparation in advance that you can do to make it the safest situation as possible, I think is really, really the way to go. And if that means taking a period of time where everybody is extra cautious, extra careful, really trying to maintain a very tight bubble of physical distance for 14 days, and then going to make a visit and to practice wearing masks in advance, to practice staying far apart. Those are the things that I think can really be helpful and make these things possible in the safest way that's possible.
I've also been amazed at how creative some people have gotten virtually and online. In my particular circumstance, all of my family members live in another state, and there's no quite safe way for my wife and I to get there. And so we have had to rely on virtual meetings, and it's nothing replaces that in-person meeting, but we could play Yahtzee together online and everyone rolls their dice, you know. And so I would say that sometimes it's a matter of allowing the person with Down syndrome and grandparents perhaps have more connections, perhaps virtually, if it's not quite safe to do in person.
Absolutely. I think that's been some of the silver lining of all of this. For some people, I think the connections virtually have been more than they otherwise were, and to be able to schedule very regular meetings and greetings and time to do things virtually, I think that that is another way to really help with that connection.
Our next question is, my loved one with Down syndrome won't wear a mask. What can I do?
Well, you're not alone.
Right.
This is a tough one. This is a tough one. Well, maybe I could, I'll throw some things in. I think the first step is to maybe do a dive into why won't your loved one with Down syndrome wear a mask? Because I think that the strategy really originates from where it's coming from. The person with Down syndrome doesn't like the fabric. Well, then maybe just switching to another fabric would be an easy solution. Maybe they're not wearing it because they just don't want to. Maybe they're not wearing it because it looks scary. Maybe they don't wear it because it feels hot, right? Maybe they don't wear it because it's novel and they don't like that sensory. So trying to do a little bit of self-discovery into what those causes are important. And then certainly once you have a sense of why they're struggling with it, I think working with your son or daughter's physician, you could come up with some strategies to desensitize them to that. If it is a matter of fabric, sometimes choosing to make your own mask together as a family, and there's lots of kits online, and we could share some links on how to make it, and sometimes them taking ownership over the color that they choose or the fabric that they choose or the picture that's on it goes a long way. Sometimes we have to make it fun, so rather than just putting it on when we have to do an activity that's not fun, we could wear it when we're watching our favorite show at home or wearing it all together and making it fun for the family and increase sensitivities. And I know many of you have really found the benefit of social stories, and sometimes we have to read about it, we have to talk about it, we have to practice it for a little bit. And there are some great social stories and social videos that are out there of wearing masks or dressing up like an astronaut or a scuba diver now, and you can wear a mask. So it's a matter of being creative and kind of investigating where they are. If push comes to shove, I would contact your state officials. I know in the state of Massachusetts, we do have a medical exemption for people who absolutely can't wear masks. And so if they absolutely won't wear a mask after trying, and that is prohibiting them from being able to get the social community engagement that they can, working with your doctor to get a medical exemption can be a possibility in some states.
I absolutely agree with that. And I think that, you know, I'm in clinic seeing my patients who, some of whom can tolerate a mask and some of them can't. And I think that all of those suggestions are great. Practicing at home, you know, making a mask that is very cute. But also if you get to a point where you have to bargain constantly with your loved one about this, I think you can say, you know, all right, when we're outside walking to the building, you don't have to wear it. But when we get to the building, you're going to put it on. Mommy and daddy are putting it on, you know, everybody in the building's wearing masks, and that's what we have to do to get in. A lot of that kind of allowing some mask free time and some time that you absolutely have to be wearing it. I've seen a lot of kids just constantly pawing at their mask because it's uncomfortable and wearing masks for, you know, 12-hour days lately. I agree with them. It's not comfortable, especially if you're an allergic type person. You know, it's constantly itching your nose. And so I found myself grabbing the mask and adjusting it a lot. So working on not touching the face. So for those people who absolutely won't wear a mask, they have to not touch their face. And I work on that a lot with kids. I've worked on it with my own loved ones. You can even do a little experiment where you have them dip their fingers in finger paints and then have them do some regular activities with stuff that you're gonna be able to wash off, and then see how often they end up with paint on their face and show them, you know, this isn't great. We're gonna be catching things if we do this. So try and get creative with what will work for your child or your loved one. And I've especially seen people with autism have a terrible time tolerating the mask. It's definitely better for your loved one to get used to wearing a mask. So I would take every effort to get them used to it at home in a safe environment first. But, you know, we're certainly allowing whatever age person with, you know, who's neuroatypical or has autism to come to appointments, to come to gatherings without a mask. Obviously, you've got to keep your exposure low, gatherings of very few people with enough space between, with enough airflow.
Yeah, I agree with everything that Dr. Lyon and Dr. Skotko said. Not that much to add, but I guess I would say, you know, there's so much that we don't have control of right now. There's so much that's difficult and scary in our environment. And I think that being able to empower people with the things that they can do is a really nice angle to take, and to leave room for some surprise. You know, I've been really surprised. I've had families say, you know, there's no way my child is going to be able to tolerate a mask. And sure enough, they have Down syndrome, they have autism, they have lots of sensory issues, and they have been able to do it with a lot of hard work. So leave room to be surprised and to accept that possibility. But I think that if we can empower people, you know, there are 3 things that we can all do to keep ourselves and our community as healthy as possible. One is wearing a mask. You know, one is staying physically distanced as much as possible, and one is washing hands. And to practice those things as much as possible, we have to model them too. You know, we have to be showing children as adults that we're wearing masks also, make it something that we practice, and practice starting now. You know, don't wait till you have to go somewhere to try getting the mask on. You know, practice it now when you can and make it as fun as possible. And I think that this is just a situation where we all have to do the very best we can.
We also had a question, would a face shield be a good alternative for someone who simply just cannot tolerate a mask?
It is.
Yeah, I think we're learning a little bit more and more that it may be a very nice alternative and may have other benefits as well, like being able to see facial expressions and read lips. So from what I can tell right now, it seems like in certain situations, a face shield might be a very nice alternative for people who don't tolerate a mask. You know, I think that there's some harder parts about wearing a face shield as well, but if that works for some people and is a better alternative, I think it's better than nothing.
The extra benefit you get is then they can't touch their eyes as well. So, you know, there's pros and cons. So wearing something, I would argue, I agree, is better than nothing.
This is another question that we touched on a little bit earlier, but my loved one with Down syndrome is a hugger. He or she has a hard time understanding social distancing. What can I do?
I think having, you know, again, like we said about masks, having a lot of practice at home is important. And I know that most parents have experience with teaching their children that they can't just run up to anybody in the grocery store and hug them. And hopefully you can build in a step where before they latch onto somebody, they've checked in with you visually to see if this is okay with you or not. I have one patient who's carrying around a 3-foot stick, and it's only 3 feet because 6-foot stick is hard to carry. But she showed me that if she holds her 3-foot stick out and I hold my arm out, that is the distance we have to maintain, which is a great idea. That won't work for everybody. And then the other thing for the younger set that are big into hugging, carrying a large teddy bear and showing the person who they want to hug the bear and then squeezing the bear really hard. And, you know, obviously with relatives, if your child is going to run up and hug the person in the legs and it's not a big face-to-face encounter, I think that's a lot less risky and it does get the affection across. But if it's a get down right on face level and hug and kiss, that is a pretty good exposure if the person seems, you know, to have any their own exposures. So if you've had a family member who's been quarantined for 14 days, they are not carrying COVID. And I think allowing a hug is fine. But I think being out in public with a kid who likes to hug everybody, you know, the sales clerks and the everybody, either you've got to avoid that environment or you've got to have a substitute hug like a big stuffed animal. So you've got to get, again, you know, your own family members, your own loved ones, and practicing at home and just repeating and repeating and repeating so that they understand this is a new and different game that we're playing. And hopefully it's a game we only play for about a year, but right now we're all playing it.
I would add another resource that's out there some people are familiar with is the Circles curriculum. I know a lot of schools, particularly those in Massachusetts, have been using it to teach about boundaries, sexuality, and bodies during adolescence. But I've had a chance to talk to Leslie Walker Hirsch, who is one of the creators of this, and I think it's a great opportunity to use this during this time because it talks about social boundaries in general. Those of you who aren't familiar with it, it kind of divides people into color-coded ways and the rainbow way. Since people with Down syndrome are very visual, we have red people who are strangers. We don't do anything with red people, even during non-COVID times. And then the orange people are the people we wave to, and yellow are the people we give that far away hug to, and green a little bit closer. And then you get the point. You work all the way in to people you're intimate with. What I like about it is it color codes people in terms of what we can do. And I know that it's working. Sometimes a patient will come to see me in clinic and they'll ask, Dr. Skakar, are we yellow friends or are we green friends? And then I always have to remind myself, okay, what does that mean? How close a hug? But I love it because they're kind of using this infrastructure to be able to think about it. And what some people have been doing is during times of COVID, you might need to move people to a little bit outside. So people that we could give far away hugs to, we now have to wave. So they need to become orange friends temporarily or yellow friends, or we need to think about that. And the curriculum also has an app that's downloadable and that's great. People with Down syndrome or others could take pictures on their phone and they could drag it. So before you go out for a social gathering, you could have a discussion as a family, what color friends are they and kind of what social contact would be appropriate.
Great. Another question, which summer activities are safe for my loved one with Down syndrome? What about community activities in smaller groups, 12 or less, and safety protocols implemented?
You know, I think we're all going to feel like we're broken records after a while, but I think some of the recommendations apply to the circumstance. One, I would say, is it safe for the neurotypical population to go out and do your summer activity no matter what state you're in? Are your pools open, for example? Are playgrounds open for the neurotypical community? And if the answer is no, then it's not safe for people with Down syndrome to begin with. The answer is yes, then back to what we talked about. What are those co-occurring health conditions, age conditions that might make someone with Down syndrome have to wait a little bit longer than when their counterparts could go forward? And then if they don't have any co-occurring conditions, then all of the things we talked about, if you are going to participate, how do you do it safely? Like Dr. Lyon said, outside is always better than inside. Keeping a distance is always better. Hand washing, like Dr. Baumer said, making sure they have face masks on. So I think taking that infrastructure, I think all three of us kind of chatted through, you could start to apply it to these individual questions.
I agree completely. And I think remembering that whichever group you expose your loved one to, now for the next, 5 to 14 days, it's possible that they were exposed to some virus. It might not be COVID. There's plenty of other viruses traveling around right now. And so if you then switch activities and join a different group, then you've got that other set of people's exposures. So if you can choose an activity that your loved one really enjoys, and then just stick with that activity and don't have 4 different activities with 10 to 12 people who you're seeing, because then you've got 48 exposures. So trying to pick something that you think is going to be popular with your loved one, and then just sticking with that for, say, 3 weeks or something. And then if you're switching to a different activity, just that activity, so you're not involved in too many pods of people or cohorts of people.
Another question is, how do I prepare my loved one with Down syndrome to get a COVID-19 test?
I've had several of these tests, and there's no preparing for it in one way, and that's very uncomfortable if you have this thing stuck way up your nose. However, there are now saliva tests available, and that is a heck of a lot easier. So not every community has those available. And most, I think now hospitals do. So again, it's, I think there's nobody who likes having a swab stuck far up their nose, both sides. But if it's time to have a COVID test, I think, again, you're not going to practice at home by sticking a swab up your loved one's nose, but you can just practice that this is how it's going to go. If you know where you're going to get tested, like right now at UMass, we have drive-up testing, and you basically can sit in the car with your loved one. They can sit on your lap, or they can be in their own seat, and a person with a full mask and gown and gloves and everything is going to put this swab through the window and put it in their nose. So practicing being in the car for that, or practicing if you're going to have a test done in a clinic, practicing sitting in the parent's lap, getting a nice hug from the parent, showing them a video or something to distract them. And then if this is going to be the nasal swab, it's going to be quick. You got to get to wipe your nose afterwards, put your mask back on, and then, of course, bribery for unpleasant tasks like that works wonders. Don't do a food bribe, do some other type of bribe, but something that'll work. And the more you can tell them what to expect, the better. Many of the hospitals, all the 3 of the hospitals that we deal with, have child life services that are helping kids walk through these experiences too. And some of them have produced videos that show exactly what to expect. So I think watching those would be another plus.
Yeah, and I think we can include some of those resources afterwards, but there's some really great social stories available, even some little animated sort of video modeling available to show how to do it. I think that, the keys, as Dr. Lyon mentioned, are, doing some sort of distracting preferred activity during it that's possible, like watching a favorite video, or some, looking at a favorite photo album, something like that, to do a little bit of distracting, but also something that's sort of timed for how long it'll take, maybe 30 seconds or so to do that. And then having some sort of reward afterwards for a job well done. And, I think that this is something that we're all probably going to have to get used to. It's not really very pleasant for everyone, but it should be quick.
Great. Our next question, how can I prevent my loved one from getting COVID-19 during the next wave?
We're lucky in this state that we have an excellent Department of Public Health that has been posting, very discrete guidelines and updating them and communicating well with the school systems. There are other states where they don't have as well-funded a Department of Public Health. So I think responding to what is known in your environment, if you know that you're living in a city, a town, or a state where the infection rate is climbing, then I think taking a step back in your exposure level would be very appropriate. This is going to make sense to you. This, again, parents have to go kind of with their gut on this. If you were hearing that the infections were again on the uptick, on the rise in your area or your state, and your cousin wanted to bring his best friend over after they partied in a bar the night before, that to your gut reaction would be a no. But if the state is if the local environment is at a pretty steady infection rate, hopefully a low infection rate, then doing all the things that, as they said, broken record, protecting yourself from exposure, mask, hand washing, and distancing. We're going to have to do this for a long time, months to maybe a year or maybe more, until we have the infection under control enough or a vaccine in place to protect people. So understanding sort of the levels of threat in your area and stepping back, even if it means canceling something important like a small birthday party, and always having a virtual backup plan in case the risk level goes up. Say you were going to have a birthday party with the 6 favorite kids your child or loved one has, and then it started to sound more risky, either because one of them was exposed to something or because the whole risk area has gone up, then you've got your backup of a Zoom birthday party or something. So being prepared to step it up or step it back, depending on what's going on and the best data that's provided to you.
I would add to think about if your son or daughter is in one of the high-risk categories because of a co-occurring condition, can any of those co-occurring conditions be addressed by a medical provider or with you to reduce their chance in the next wave? We know for the typical population, obesity is actually placing the neurotypical population at serious complications from COVID-19. And I don't think we have any reason to believe it wouldn't also be the case for obesity, also placing people with Down syndrome, particularly in the older category, at serious complications. So if you have a loved one with Down syndrome that is in the overweight or obesity category, now is the time more so than ever to work on it. And I think working with a local nutritionist, many of whom are available through online Zoom consultations to develop a personalized plan, is really important. And of course, fitness is really important during times of COVID, and there are many safe ways to make sure your loved one exercises. So knowing your loved one's body mass index and trying to work on reducing that complication could be one of them. If they do have any chronic lung or heart conditions, working with their doctors to minimize those as much as possible to make sure those are fully addressed could go a long way. And I would also make a pitch that it's really important now, so more than ever, for people with Down syndrome to get a flu shot, so long as there's no co-occurring activities or co-occurring conditions that would prevent that. But it's very possible that our flu season is going to peak again when we have a second COVID peak, and getting both of the viruses at the same time could be especially serious. And we also have research to show that many people have been staying at home and not going to primary care doctor visits during this time because of fear of doing so. And a lot of the younger kids might be falling behind on their typical vaccination schedule. And I would emphasize now is the time to make sure they're up to date, because we just don't want to be hit statistically with 2 things at once, which would make it very complicated.
If your immune system is busy working on the influenza, you're going to be much more prone to catching COVID. And if your lungs are inflamed from just having gotten over influenza, you're going to be at a very high risk for complications of COVID. So I completely agree with what Dr. Skocko just said. I think it'll be hard to get yourself out of the obese category and into the normal weight category now, but it's always worth pursuing, of course. And keeping in mind that even if you've had concerns in the past about the safety of the flu vaccine, it has been found to be very safe. I highly recommend it. And it is a way of making sure that your body is at its most fit to get through this COVID season.
Another question is, how should I discuss COVID-19 with my loved one with Down syndrome? I think we touched on this a little bit before, but worth revisiting.
One thing, I think a lot of us know that individuals with Down syndrome can be very sensitive and in tune with the emotions around them. So high levels of anxiety, high levels of emotion are easily picked up on. And so I think, remaining calm, talking about COVID-19 in simple, factual ways, using pictures whenever possible, talking about the things that we can all do to protect ourselves and protect our community and turn it into sort of empowerment in those ways, I think can be really helpful. Talking about new rules that are part of this time period. So just like we have to wear a seatbelt in the car, or we have to wear a helmet when we're bike riding, the things that we sort of have to do as rules now to make sure that we can keep ourselves as safe as possible, I think are all really important strategies. Trying, I think, as much as possible to minimize the sort of near constant exposure to the news. So we used to have the news on in our house and constantly looking at headlines and hearing that. And I think sometimes just that level of exposure can be really overwhelming. So trying to minimize that when possible and trying to control the information so that it's delivered in a way that is digestible can be really helpful as well.
And I think between all of us, there are some great resources that we know of online that could help guide these age-appropriate discussions, and we can make sure that those links are available afterwards so people could do that. I also, an ancillary question to this I've been starting to get is families have been hunkered down together at home, and in many ways, sons and daughters have learned a new normal, and that is mom and or dad or other parents are always around. And oftentimes now we have a parent or a loved one needing to go back to work for various reasons. And this is separation that's going to happen because I've gotten used to having mom or dad around all the time. And how do you have that discussion on why mom or dad needs to get back to work and why they're safe and providing levels of comfort? And there's some great resources to explain why mom and dad might need to leave to go back to work and why everyone is safe in the family. And we can make sure those are included as well.
Another question, how do we balance our fears and anxieties about COVID-19 and our hesitancies of our loved one with Down syndrome re-entering the community with the social isolation and mental health concerns that quarantine is causing?
I think Dr. Baumer spoke a bit about, the anxiety level in our society is extremely high, and it is warranted. It's not, panicky. It has been a frightening time for everybody. And modeling for your loved one that you feel safe, that you trust that the rules are in place and are going to protect us is the best you can do, I think, to help them deal with their own anxiety about what they've understood. I mean, it sort of feels like the zombie apocalypse, at times, and they're going to notice the differences when you get them back out into the community. I think that there was a big uproar when the American Academy of Pediatrics pointed out that social isolation is going to be damaging for children and for teens, and especially those who have extra learning issues. So breaking their routine, getting them away from their supports, it has been damaging. And doing video visits with people at home, they feel safe because they're home, but there's a lot of stress at home in coping with being with each other 24/7. So I would say to balance between what is too isolated and hunker down and what is enough exposure in the community, definitely you have to get started slowly. Right now in our state of Massachusetts, it's actually a pretty good time to explore this, I think, and to, certainly review with your loved one how you feel confident this is safe, how you're going to do it. Tell the story as best you can about what to expect. We're going to walk down here. We're going to buy an ice cream. We're going to sit on this bench away from other people. Going to eat that ice cream and come home. And it'll be really fun to see people walking their dogs and, tell them what you're going to expect. And then obviously, if the situation is crowded you're not expecting that, you just have to say, oh, this isn't the one we want to do. This isn't the right situation. This doesn't match our story. We're going to go home. So I think just like you do for many other situations, trying to create the story and model that you are confident things are safe, and then getting them out there, and you'll, I'm sure, see your loved one blossom again in seeing other people and other places. That's, you know, I think we have more to talk about when we're talking about getting back to school, but that's how I would say you should balance things now.
And I would just second, caregivers, you have to take care of yourselves, right? This is such a hard time. And I know we hear from families, what should I do for my loved one with Down syndrome, loved one, my kids, but oftentimes we forget to take care of ourselves. And it's just so important to take a break. If you happen to be out there where your family who you know you love is driving you crazy and your nerves are being frazzled, you are not alone. And sometimes you need your own break. We also know that if you don't feel safe or you are a victim of violence at home, you are not alone. And we know that people being locked up also has brought a lot of cases. Know that your voice is important. You should reach out to your primary care doctor, reach out to those who could help you. Sometimes being hunkered down and locking the doors at home really starts to bubble up a lot of challenges within families. And we're here to help you and make sure that you get through this to the other side. Simple things such as meditation and gardening and yoga. It's not for everyone, but there is something for everyone. It's a matter of you finding your own mental space and your own time off, even when you might be sequestered at home.
Another question, my loved one with Down syndrome works. What should we consider before a return to work? And what questions about safety protocol should we ask their employer?
Well, we know one of the risk factors is age. And as Dr. Balmer was talking out loud, that people with Down syndrome, perhaps 40 and older, we're starting to see some data that they may have higher complications from getting COVID. So if you do have a loved one with Down syndrome who's 40 and older, I would have some serious conversations with the employment, with the person with Down syndrome and their physician about making sure that all the safety mechanisms are in place before going back to work. Otherwise, I think everything else we talked about in terms of preparation and cleanliness and the risk-benefit analysis would apply here to work as much as it would apply to school.
And I think we should also bring up, because I don't think we have a question on this, you know, if they are living in a group situation versus having returned home for our older patients and friends. And, you know, what we know about the general population is that it still applies to people with trisomy 21. If you are in a nursing home, a group home, an institutional setting, there's a much higher risk for that person. So I know some families have actually gone and picked up their loved one and brought them home. And I think it's a very hard question to answer when they can go back to their group living situation. Many group living situations had to make big adaptations to get larger spaces, to get better airflow, asking about improvements in the HVAC, asking about backup plans for contingency plans if someone in the group setting falls sick. Those are the same questions you should be asking about a work situation. You know, one of my patients is back bagging groceries. He had stopped for a while and he's back doing it. That's a very high exposure, but the store he worked at took a lot of precautions. And he really, really wanted to return and see all his clients. So he is back doing it. He does not have a heart condition. He does not have asthma, and he is under 40. So I certainly supported that decision. But, you know, his family and he trust his employer. They're doing good employee screening. They have plexiglass up in some places. They are taking precautions. They are not allowing a single person in their market without a mask. And they are doing a lot of cleaning of the work surfaces. So those are the questions I think to ask. Is this work place keeping to the recommended maximum number of people in a space? Are there very easy to access places to wash? Are the surfaces being cleaned frequently between customers, between clients, whatever? And these are all laid out on the Mass Department of Public Health website very clearly for employers of all sizes. And don't hesitate to ask if you feel like they are just barely meeting requirements or struggling to meet requirements. Then when things get worse again, they will really be struggling to meet requirements. So I think it's very appropriate to ask and even go to this place and look with your own eyes.
All right, I know we only have a few more minutes, so we're gonna rapid fire these next few questions. Helen just touched on this, but my loved one with Down syndrome lives in a congregate living setting. How do I ensure they remain safe and healthy?
Yeah, sorry, I anticipated the question. I wanted to move in. So these are very difficult. I think they, the congregate living setting is going to have to be a cohort. They're going to have to be a group of people that is not exposed to large other groups of people. So my friend who's working in the grocery store has actually moved home so that he won't be exposing his friends in his living situation. So I think the congregate living settings have usually been a limited number of people. And if they have low exposures and low health risks, and they've taken the precautions that are well laid out for group living situations, I think they can stay safe there. I feel like most, and Dr. Scacco can probably comment on this too, most of our older friends and patients have, for a while, had moved out of their living situation to come home until the requirements were met for safety.
Yeah, I would agree with that. And I also agree, Dr. Lyon, as you mentioned, our Department of Public Health here in Massachusetts has now come up with very detailed descriptions of what does it take to make sure that congregate living settings are as safe as they could be. So no matter what state you're in, be sure to check those out. Those should be a bare minimum. And nothing beats communication, just open and honest communication with your congregate living setting to understand what are the rules, what are in the place, and what are the risks. We can't make all the risks go away, but at least knowing where those risks are, you can know where the exposure points might be taking place.
All right, we'll do this last question together. I know a lot of people had questions about it. Is it safe for my loved one with Down syndrome to return to school in the fall if proper safety precautions are implemented? Think masks, physical distancing, hand sanitizing.
I hope so. You know, this has been one of the hardest things that we've been talking about for months now. And, you know, I think that, you know, the current American Academy of Pediatrics guidelines, the CDC, everybody seems to be acknowledging that it is so important for schools to be able to reopen safely, and especially so for children who are receiving special education services. We know that people who have Down syndrome and who have other special education needs are probably the most negatively affected by school closures and by reliance on distance learning. It's just, for most of us, not the best way to learn and to teach. And so, you know, I think that the best hope that we have for getting kids back to school safely is to do all of these things that we've been talking about to keep the spread of infection and the community rates of infection very low. That's our very best bet. And I think that for most children with Down syndrome, we hope that they will be able to have the safety measures in place so that children can go back safely. That means making sure that the schools have really important safety protocols in place, that they're in very close communication with public health officials, with physicians, with the folks that are sort of monitoring the situation very closely and being able to give good guidance. We know that the mask wearing is going to be important. We know that the hand washing is going to be important. And we know that maintaining the distance is going to be important. So those are the three things that that we need to keep working on to make the school situation as safe as possible.
And we'll also send a link there. So the Massachusetts Department of Elementary and Secondary Education wrote a great report about this last month. It's 25 pages long, but so you don't want to read the whole thing, but they are talking about what are the minimum requirements to meet. And there is funding in the CARES Act to go to school systems. In Massachusetts, they kept a lot of that funding back as a discretionary way to give it to school systems that will have more trouble meeting the guidelines. So I think getting in touch with your school system, your special ed teachers, and finding out, are you guys getting funding? Are you hopeful that we'll have safe scenarios? What are you guys doing about cohorting? What about hand washing stations? All of that. Now is the time to sort of do the campaigning so that your town and your school system gets a piece of that money. And if you are not convinced that your school is able to follow the guidelines that have been written, you have the option to do home education. I think that getting back, even if it's in a more limited way, is better than home education for most of our people right now. But if you feel the school just isn't ready come September, you can hold off till January. I see towns taking very different approaches, and it's going to be very individual, but there are written guidelines now, and I'm very happy with that report.
And this situation is just so fluid, right? None of us could really be predictors of how this virus is going to change. And I share the hope that things will get better, but they might get worse before they get better. And so the best laid plans for September might not be the best plans for October or November. So always kind of think about alternative solutions and make sure you have your backups. And then we just encourage all of you who have a loved one with Down syndrome on an IEP to keep track of the services that they are receiving so that when we do emerge post-COVID, and there might be opportunities for compensatory services, you have a record of what was received and what was not received. And there are some great apps that are out there right now for you to be able to keep track. So document, keep it handy. And then when we're allowed to do so, we can kind of see what are the compensatory services that some people might be eligible to receive.
Well, I just want to thank you all for joining us today. I know this is a very important topic, and we appreciate Dr. Skako, Dr. Balmer, and Dr. Lyon for sharing their expertise with us as we all navigate this uncertain and difficult time. As we mentioned, you will receive a follow-up email with a link to resources as well as the recording. And just thank you all for joining us. We hope you and your family stay safe during this challenging season. And if there's anything that we at the MDSC can do to support you and your loved ones, please do not hesitate to reach out. Thank you, everyone.
Thank you.
Thank you.